Hello.
Can you hear me?
Yes, yes, I can hear you. Let me just start. Um, Good evening, everyone. Today we're going to our 11th session of Listen and Learn webinar series, and we have Dr. JYOTHSNA with us, who'll be speaking to us regarding the integration of AYUSH in practice. It is actually a very novel and innovative way of consultation that most of us are not aware of. So I welcome Dr. JYOTHSNA. She is a consultant at AYUSH Ayurveda in Bangalore. So welcome Dr. JYOTHSNA again, and over to you.
Thank you, doctor. Okay. Good evening, everybody. My name is Dr. JYOTHSNA. As mentioned by Dr. AJULA, I work for AYUSH Ayurveda. I'm an Ayurvedic consultant with them. So today, let me first share my screen so that we can go to our today's topic. Hello?
Hello. Yes, JYOTHSNA.
I got it. Yes, I got it.
You can start sharing. Yes.
Yes. All right. So the topic that today we're going to discuss is integrated AYUSH. So why to integrate, how to integrate, and what is the importance in integrating, how patient is going to get advantaged by all this integrated practice is what we're going to speak today. So before going into integration, let's see what AYUSH actually is. So AYUSH is a ministry. So from last 2014 November, it has been formed as a ministry. So Ministry of AYUSH was formed in November 2014 to purpose basically education, research, propagation of indigenous alternative medicine system in India. So now the ministry head is headed by Minister of State, which is currently held by Mr. Shripad Nayak. The ministry runs multiple health activities which primarily focuses on rural population. So for example, activities like Ayushman Bharat Yojana is all conducted by Ministry of AYUSH. So what are the departments under AYUSH? Under AYUSH we see Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy. So quickly, before going into the details of each branch, that's a vast subject though. So instead of going into detail, let's brief and see what each branch deals with. Now they going to treat the patient. So first one is considered to be world's oldest holistic healing system. It is believed to be developed more than 3,000 years ago in India. So it is based on the belief that health and wellness depend on a delicate balance between mind, body, and soul. So whatever they're going to give treatment, it will be based on mind, body, and soul. So next is yoga. Yoga is translated to union. Everything is composed in the body, so that is the union. So yoga includes breath control, simple meditation, adapting specific bodily postures. So yoga is widely practiced to maintain good health and also for relaxation. Next comes naturopathy. So the name itself says it's based on self-healing. So body itself can heal within itself. So naturopathy is a system of medicine which uses the concept of diet control, physical activity, and massage to treat each disease. And it basically avoids the usage of drug to treat any disease. Next is Unani. Unani system of medicine is a science of healing heart. So where Unani treats a person as a whole, not as a group of individual. So each treatment is given for one particular person. So in Unani also aims at treating body, mind and soul. Next comes Siddha. The word Siddha is translated to Tamil word which means perfection. So Siddha medicine is a traditional system of healing which is believed to be originated from South India and is considered to be one of India's oldest system of medicine. Siddha is based on combination of ancient medicinal practice and spiritual discipline. Similar to other systems, they also concentrate on mind, body and soul. Next comes homeopathy. Homeopathy is based on the concept like cures like. So according to homeopathy, in order for a remedy to be effective, it must cause healthy person a similar symptoms being treated in a patient. So homeopathy also concentrates on patient's individual. So again, they also indirectly or directly have the treatment plan planned according to mind, body and soul. So what is that we see common in all the system of medicine is they have a common aim. So what is the aim? To save the mankind from misery, to gain victory over disease, to maintain the health of the healthy. So all the system of medicine concentrates on these three things. So when the aims are same, why not integrate? So coming back to our today's topic, which is to integrate Ayush. So why we integrate, what is the advantage, how patient is going to be beneficial with integration is what we're going to speak about. So first is, what is integrated practice? Maybe a new term to most of us, or maybe something that we are going to learn today. So basically, what is integrated practice is to understand the importance of including other system of medicine in one's medical practice is integrated Ayush. Integrated practice. Sometimes in our day-to-day practice, we doctor advise patient to include yoga, meditation, sun bath, and other remedies along with prescribed medicine. So this connects to our branches of Ayush. So there also we see sun bath, there also we see meditation, yoga, medicines, everything put together. So this itself is a integrated practice. So what if this whole concept is practiced under guidance of a qualified doctor? That is what we're going to see today. Since all the system of medicine concentrates on speedy recovery of patient and minimal reoccurrence. So all the systems are patient oriented. So all the doctors who are going to deal with these cases will be patient oriented. So speedy recovery and same health concern repeatedly. That itself is, that's how we reduce the reoccurrence. So let's see how patient is helped with the integrated practice. How is patient going to help? So initially patient feels better symptomatically. So when we doctors get a patient in the clinic, first thing patient, after all the history that they tell us, they're going to tell us one thing: I need to feel better, I'm in too much pain, I need to feel better immediately, give me something that is going to immediately give me relief. So obviously patient is going to feel better symptomatically. Again, all the system of medicine, Ayush, they consider addressing the root cause as a main base. So integrated practice will be concentrating on root cause. After once the root cause is addressed, symptomatically patient is feeling better, that comes to health improvement. So overall health is improved. Next is patient is satisfied with the speedy recovery. Obviously, when the patient is symptomatically feeling better, so he is towards positivity. So he thinks, yes, he's feeling better. So that itself is speedy recovery. Next comes maintenance of health of the healthy. So once the patient is being treated, again, he has to be followed up for health. If he is fine, if there is any reoccurrence, everything needs to be addressed. So what is the need of the patient? To understand the need of the patient. Patient wants speedy recovery. He wants the root cause to be addressed so that he don't have reoccurrence. Again and again, he don't fall for the same health concern. And again, he has to maintain his good health. These four things are what patient always want. So how do we put these things together? So we saw how integrated medicine is going to work, how we are going to help the patient, and how patient is going to be benefited. Now, how to put all these things together. For that, we have first thing is team. So the team will be the doctor and the patient team. So first, our main team will be doctor's team. So doctor needs to understand the importance, like I mentioned earlier, doctor needs to understand the importance of including other system of medicine in his practice. So it's because doctors are all patient oriented. If patient is getting benefited with yoga, then obviously I will prescribe yoga. I will advise patient to go for yoga. So I understand the importance of having integrated practice. So a team of doctor needs to be created who understands the importance of including other system of medicine in their practice. So the doctors needs to have that good bonding, good connection, and how they connect with the patient, how they are going to present their team. Everything needs to be in a team. So that's why the team of doctor needs to understand, including the importance of integrated medicine. So how to do this? This can be done in a clinical setup where the patient can be invited and the doctors can be invited. But today with our pandemic situation, we can have a virtual consultation. So virtual consultation can be, these days patient have BP apparatus at home, RBS machine at home. So even if you don't get a accurate result, at least you'll have overall information as to what is his BP, what is his pulse, what is his blood sugar levels, what is his weight. Everything can be assessed from patient's end. So you can take inputs from the patient and do it virtually also. So the next part in this would be the patient. So obviously the team of doctors is fixed and the patient is coming to you. The patient first of all needs to be educated about the importance of integration. So maybe the patient says, today also we can see in our OPD that patient might say, I'm already taking medicines for my cholesterol condition or for my liver condition or for my hypertension condition. So can I include your medicine also along with that? So you need to tell the patient how it is going to help them. So for example, if the patient is already taking a hypertension medicine, I should not be again prescribing for hypertension medicine. If in case the patient is, if the medicine is working, let him continue the same medicine, address the medicine which is, address the health concern for which he is come to you. So next is case history. So how do you care? For example, you have a team of doctors. AYUSH itself has 4-5 branches. So all of them sitting together will be discussing the case history. So you cannot like pop up questions immediately with the patient. It has to be done on one-to-one conversation. All the doctors are present, but only one doctor speaks at a time. So when this happens, patient sees that there is one concern. Patient thinks, okay, a doctor is interested. Doctor is giving importance to me. All the doctors are concentrating on my health concern. They are working towards my good health. So when that happens, patient gains a trust on us, or that, that bonding with us. So they will disclose things which we might not ask them also. So in that case, we have to have that bonding with the patient. So once you start that bonding, patient will give you everything that you need. Time also they'll give you, maybe take some time, maybe, patient wants speedy recovery, but then you can convince him to tell him that yes, it's going to take time, but at least the root cause will be addressed. So that's how you're going to take case history. So again, during case history, you will have, we doctors, we know how to take case history. Starts with name, gender, age, what is their professional, what profession they belong to, what kind of diet they follow, what kind of, diet they follow, physical activity they follow. Everything will be taken during case history. And also their family history, personal history, what is their previous history, medical condition, everything they will disclose to you. This all will happen only when you have that bonding with the patient. The next is to avoid repeated question. So especially with female patients, for example, if you repeatedly ask a female patient what is their age or what is their body weight, they might get irritated. And next thing they will think doctor is not concentrating on me. Doctor is not interested in me. So that should not be happening. because patient has come to us. We being a patient-oriented doctors should concentrate on the patient. So let's have an example as to how we can, how integrated medicine is going to help a patient. We just had one small example. This is for one particular health concern. So the example goes on. So Mr. Raju, 45 years old, presents to a team of doctors with borderline increased with blood sugars, along with history of hypertension, sleeplessness since few months. He is on Unani medicines for hypertension since 5 years. So here we have so many points. So Mr. Raju is 45 years old. So he had his borderline sugar is increased. It's only very borderline. Along with, he is already a known case of hypertension and also sleeplessness. And along with that, he's taking Unani medicines. So he's come to you with this health concern. Let's see how it is going to help him. So he meets our team of doctors. They're going to have all the history taking, everything. So first thing you need to ask the patient is, what is his latest blood pressure readings are? So blood sugar was checked when? Since when he's got sleeplessness. All this can be addressed and you will be able to analyze if the Unani medicine is helping him. Then the Unani doctor is going to tell, yes, it is helping him. Let him continue with the same medication. If it's not helping him, then he needs to increase the dose or change the medicine. And he's borderline blood sugar. So who is going to address blood sugar? Who is going to address the present hypertension condition? Who is going to address the sleeplessness? Everything needs to be discussed between the doctors, which is our next topic, which is doctor's discussion. So once you finish the whole history taking with the patient, next thing would be doctor's discussion. Better to have the discussion in the absence of patient, because when you are discussing, when doctors are discussing, patient might go into panic. You might think, okay, I have so many health concerns, even though it is not a big case. For example, if you see in Mr. Raju's case, he's 45 years old with borderline increased blood sugar, and he's already taking hypertension medicine and sleeplessness. It's very simple case which can be treated. But if you, when the doctors are discussing, the patient is hearing, they might go into shock, telling, okay, I have a huge health concern which needs, more medication and everything. Maybe it's a simple case where the blood sugar needs to be addressed, and hypertension needs to be addressed, sleeplessness needs to be addressed. You can do yoga and decrease it also. But when they hear the doctors discussing, they might think it's a major issue. So that way you should not put the patient into panic. So always have the discussion in absence of the patient. So next would be to discuss who's addressing the main health concern, followed by who's addressing the associated health concern and the well-being of the patient. So we'll go back to our example. So in our example, the main health concern Mr. Raju has come here is for his borderline blood sugar, because he's already taking medicines for hypertension and sleeplessness also. Maybe he's taking or maybe he's not taking. We have to find out from Mr. Raju. So here it can be like, maybe the homeopathy doctor or the Ayurvedic doctor wants to take the lead and get on the blood sugar levels. Along with that, to overall health, you can ask the yoga instructor to give few yogasanas which is specific for his health concern. And again, diet and physical activity will also get down the blood sugar levels. So again, yoga is involved, naturopathy is involved, Ayurveda is involved, homeopathy is involved, Unani is involved. So all the medicines are involved. This is how Mr. Raju is going to get help. Here, what you see is the main concern would be blood sugar levels. Associated can be his hypertension and sleeplessness, and also his age. So along with it, you can also ask if Mr. Raju has any other associated complaints, maybe a lot of pain in the joints, or maybe headache, or maybe vision issues. Everything can be addressed. So when you are taking history, every detail should be accounted. Maybe the smallest of the smallest symptom also needs to be addressed, because patient feels better when they tell the doctor. So next comes our treatment plan. Once we finish the discussion and who's going to address which health concern, who's going to do the well-being of the patient, everything is discussed and it has to be conveyed to the patient. How do we convey? We convey through treatment plan. So the treatment plan need not have all the systems, advice or medicine. For example, maybe we can come back to Mr. Raju itself. Mr. Raju is already taking medicines for Unani. I mean, he's already taking hypertension medicines from Unani. So Unani doctor can increase the dose if it is not helping him, or decrease the dose if it is fine. In the same way, maybe the Ayurvedic doctor says, no, the homeopathy doctor can take the lead and no, he can prescribe the medicines. In that way, Ayurvedic doctor need not prescribe. No, let it be, need not prescribe. Next thing would be, again, yoga and naturopathy doctors will be advising on yoga, physical activity and diet. Or maybe already Mr. Raja has a good diet, then again, naturopathy doctor need not give any advice from his side. But the treatment plan should include advice for all the health concerns mentioned by patient. So for example, we'll go back to our Mr. Raju itself. So maybe Mr. Raju says, you know, he's got sleeplessness from very long time and he's got acidity from very long time. So even the smallest of the smallest symptom needs to be addressed. Because he's already pre-diabetic, is 45 years old, sleeplessness, hypertension. And he also complains of pain in joints or maybe acidity, everything. So in that case, you will have to address even the smallest of the smallest health concern. And next will be prescription. Obviously, the doctor, whoever is going to treat, will write the prescription. So one important thing that needs to be avoided is prescribing for same health concern. Two doctors cannot prescribe for same health concern. For example, in case of Mr. Raju itself, Unani medicine is already taking. It is helping him. Let him continue. Again, as Ayurvedic doctor, I am not going to give him for hypertension. In case if I give him for hypertension, the drawback would be dropping in blood pressure. So hypertension and hypotension are equally dangerous to mankind. But what the important is, hypertension is immediate. Hypertension is very slow. We never get to know. So it should not happen that way. Or maybe for his main concern is blood sugar levels. So if blood sugar levels, even I'm getting the blood sugar level down and even the homeopathy doctor is giving the blood sugar down, getting the blood sugar down, then that's going to become hypoglycemia. Again, a emergency condition. We'll be discussing who's going to address the main health concern, who's going to do the associated complaint, who's going to do the well-being of the patient, who's going to do the yoga, who's going to advise for physical activity, diet, everything needs to be discussed when the doctors itself discuss. Next is follow-up. Why follow-up is important is the doctor needs to know if the patient is fine. For example, let's go back to Mr. Raju itself. In Mr. Raju's case, I say within 90 days, I'm going to get down the blood sugar levels down. So accordingly, I have to prescribe. So accordingly, even the naturopathy doctor will give advice. Accordingly, the yoga instructor is going to give advice. And accordingly, the Unani doctor is going to prescribe for hypertension. So if I say in 90 days, at least by 60 days, it has to be halfway through. So is it working or not working? I have to know. So that happens with follow-up only. When I say, Mr. Raju, you're going to be fine within 30 days or say 90 days, by 45 days or after 60 days, I'm going to follow up with them. We will ask the patient to come to the clinic or connect with you through virtually or whatever it is. We can connect with the patient and find out if it is working or not working. Because we're aiming on speedy recovery. So speedy recovery is lesser duration. So within 60 days when I follow up, I get to know if it is helping him or not helping him. If it is not helping him, and again we're going to call the team of doctors and see who is going to help the patient better. So again, follow-up is important to understand the results. So only when we understand the results, patient is benefited. Otherwise, the patient is not benefited. So in the same way, we can also have palliative treatment done for patients like senior citizens. We can have palliative treatment done. Maybe, Ayurvedic doctor can prescribe for external application. Homeopathy doctor can prescribe for overall well-being, and also maybe they are already known case of diabetes or hypertension. Maybe they're already taking medicines. So that way we will be advising accordingly. Maybe yoga doctor will be giving yogasanas. Naturopathy doctor will advise on diet, physical activity for palliative care. And also there are a lot of health concerns which can be cured with integrated medicine, because integrated medicine depends and focuses on addressing the root cause. So integrating Ayush should be a new initiative towards good health. Thank you for your time.
Thank you, Dr. Jyotsna. That was a very nice presentation and it was very enlightening
Thank
also. So we'll go on to our Q&A session. I'll ask you the first question. How can we decide which stream of medicine to go for so and so complaint? Like when we are going for a multiple complaints in a patient, how can we decide which stream of medicine to start for what complaint?
Understood. Okay, so this again depends on the history taking. So when we do history taking, we get to know if the patient is taking medicines already for which health concern and which is the presenting complaint, which is the main health concern or associated complaints. According to that, the doctor will decide which is going to take a lesser duration and effective. So duration should be less and the medicine prescribed needs to be effective. These two things if we follow, then we can see which is going to help the patient. How patient, which is going to be advantageous to patient.
Okay. And is this good for palliative care and in cancer patients too?
Yes, so palliative care, it depends on what is the health concern. So palliative care, if you see, maybe, patient is already known case. Why do we call it palliative care is because there are so many, even though medical field has made so many achievements, there are, of course, there are drawbacks where we are not able to find medicines. Maybe in senior citizens, if you see diabetes is almost, we cannot say it will come to normal. So in that cases, palliative care is the only care which we can do, which is like, symptomatically treating the patient. If we symptomatically treat, I mentioned earlier also, if we symptomatically treat, at least patient will be able to have a better lifestyle. For example, in senior citizens who have already, pain in joints, knee joints or ankle joints or frozen shoulder, if I start giving him overall medicine, maybe Ayurvedic doctor can prescribe any external application or some, therapies, and homeopathy doctor can give internal medicines which can, reduce his pain. And again, yoga and naturopathy doctors will obviously help them with, yogasanas, physical activity, diet. So all this put together will at least get down symptomatically, the patient will feel better.
Okay. So does this affect negatively? Like, does it have any negative effects?
Sorry, I couldn't get you. There was a break.
Uh, does this kind of a treatment, does it have a negative effect?
Negative effect here would be, it can be from both the sides. For example, I told you even in Mr. Raju's case, so I say within 90 days, I'm going to get down the blood sugar levels. So here the patient also needs to, patient also needs to be having the same wavelength as the doctor. So of course, I advise him to, cut down on all the sugar level, sugar food and everything. But if Mr. Raju is not ready to cut off on sugars, then of course there will be a negative effect.
Okay. Is there any controversy over medication? Like, does it affect the patient's health if we like combine all the systems together?
Okay, so asking if there is any controversy.
Yes.
Okay, understood. So see, for example, patient, of course, there are patients who are, paranoid about taking same medicines, same, maybe patient is already taking Ayurvedic medicines for some health concern, and then they might say, is it fine if I take Unani medicines also? And what here the patient needs to know is you have to openly tell the doctor that yes, I'm taking hypertension medicines for Unani and I want to change to Ayurveda, or maybe I want to have a better lifestyle. That way, if you tell openly to the patient, I mean to the doctor, then doctor will know already you're taking medicines for hypertension. So obviously I'm not going to prescribe for hypertension. I will address the other health concern, maybe the associated health concern. In case of hypertension, it can be headache, sleeplessness, or maybe hyperlipidemia. So I will be addressing the other health concern, which in turn will be helping the patient. Overall health is improving.
Okay. And why is this important in these years as we are going on through this pandemic situation?
Sorry, I didn't get you. There was a break.
Why is this way of treatment important in these years as we are going through a pandemic?
So of course here, if you see with the pandemic health concern, how we can help them is if patient is not able to go out to a clinic, so we can do virtual consultation. How integrated medicine is going to help them is, for example, if you see with the pandemic situation, physical activity and diet is what everybody is doing these days. Obviously, our yoga doctor and naturopathy doctor is going to help them. Ayurveda doctor, homeopathy doctor, and Unani doctor is going to enhance the whole treatment plan.
Oh, okay. And what are the barriers for this treatment to happen? What are the barriers?
Barrier here, of course, what you can say is barrier, we cannot call it as a barrier. Maybe, no, the duration, I say it is going to be 90 days. Maybe after 4 months or 5 months, he's going to feel better. So that becomes, that you need not call it as a barrier. It's only delay.
Okay.
So the patient has to have the patient to go with the doctor.
They should obey the doctor, right?
Not obey, we all have to have the same, we have to be in the same page so that we
Mindset.
understand what is important.
Okay.
Yes,
So
of course.
thank you so much. Now I call upon Dr. Sharath for vote of thanks.
Thank you, Dr. Ajula. Thank you, Dr. JYOTHSNA. Is it audible for?
Yes, yes, you're audible.
Yeah. Thank you, Dr. JYOTHSNA, for the enlightening speech, talk, and the valuable time. As is a pandemic time, this is a very valuable topic, as I believe that combination of an AYUSH, Ayurveda, Yoga, and other systems can do something positive, and integration of all those positives can bring out a common concern on health. And without medicine, and without medicine, that some system like yoga systems, it doesn't have any medicines, but they were having some protocols that enhance the total immune and health. So the integrated Ayush is a nice concept and nice vision that can be bring out, or that can be put forward to the government, as you said, as you talk and lights. And thank you everyone for the participation. Thank you Sri M.K. Shashidharan Nair for creating such a space. And thank you everyone. Thank you for the hosting. Thank you.
Thank you, Dr. Sharath.